Hello, doctor.
Hello.
So this is Coffee and Childbirth, but I forgot the mics today. So we're going to do something resourceful and just move into doing this, recording this way.
Yes.
But
We're all set up.
We're all set up. And I was like, maybe we could use our backup mics that Bottega let us borrow. That was an option.
That didn't work.
That didn't work. So, but we still wanted to talk to you all about the topic. Our topic last time was pregnancy and sleep. And then Dr. Rhee was like, okay, let's talk, what about the babies though? And so we'll talk a little bit about babies and sleep. What do you feel like as a chiropractor, Dr. Rhee, you see the most challenges with? Like, what do you often see moms complaining of when it comes to sleep?
I think the biggest complaint is their inability to kind of deregulate down or regulate down. And I get a lot of kind of like very restlessness, right, after dinner or during dinner time. And so this desire of not wanting to be in bed. And I guess that depends on the age group as well. So if I have like toddlers, like older toddlers, and we're talking about that, then for sure, I think the overstimulation of all the things that they are consuming, regardless if they're conscious of it or unconscious of it, they're constantly consuming information during the daytime. And I think there's a lot of overloaded kids. And so that causes them to not be able to regulate themselves and then actually get into a space of falling asleep. If we're talking about newborns and infants, that's a little bit different too. Even though I do think because parents and adults and just the society, we're always in front of a screen, that also has, regardless if the parents are aware of it or not, I have seen it where infants and newborns are constantly, their eyes are tracking screens, even if they're not in front of it, right? And so that really messes up with their routine of sleep at night as well.
So if we're taking, as a PT, if I'm typically will bring it into a certain age range. So last time we talked about prenatal.
Yeah.
So if I'm talking about birth to first year, so birth to first year, like you mentioned, the regulation of their system, but also agree with you on that there's a lot of things happening within, even if I take that first year, most often the things that I see from a PT perspective, if they are having challenges with feeding as well, if they're having challenges with like that baby who hasn't even necessarily moved yet. So like pre-crawling, and then once they're moving and then potentially walking. So almost like birth to 8 months and then 8 months to a year, when they're more independently moving around. I agree with you on the fact that like there's a lot of things happening externally. I think one of the things also that's interesting is the amount of kids I see that are also having trouble feeding, so they're not full. So there's like, they're actually, their ability to have that satiation and go into that regulated to digest anything is really hard.
Are we talking about like infancy then?
Yeah. So I'm saying birth to 8 months. So birth to 8 months where you have kind of combative issues because they're learning huge milestones. And so that's not a bad thing, but it is harder if they're learning like how to roll, how to crawl, how to, like we were saying.
A lot of information processing that's happening.
And that's just if they were in their own little cubicle, their own little home area. But most often that's not the case. Most often they're like out with family or out with their mom or something like that.
I think if we are talking about like infancy, like birth to a year, definitely comfort, like finding comfort from mom. That's been like the biggest thing. So I guess I'll change my answer. If we're talking about a birth to a year, I think comfort is like sense of security. And then obviously going back to just a lot of the screen time triggers. And again, it doesn't mean that the parents are putting a screen in front of them, but if the mom's watching, has the TV on and is doing housework, there's a lot of noise and things that are not organically happening, that is happening on the screen, that you can see it too. Like even for me, when I have infants, I have to be mindful of it as well, because I've got two large screens in my room. One, obviously I'm facing it right now. And then I have another one that I use for my x-rays. And immediately when the x-ray images are up for anything that is actively, with the bigger screen, my infant will gravitate and turn their head almost instantaneously. So I do think there's a huge impact in all of those things that's happening day to day, just normal things that we do as a modern society. And I think there is definitely an impact in their sleep. And then I think as you said, feeding, I think that's a huge part of it as well, for sure. Yeah.
Right. Because reflexively in that first window of time that they're going to be learning this skill and learning how to drink, learning how to eat. So drinking from the press or the bottle, but that liquid diet that they have initially, and it goes beyond that depending on how you want to feed your child, but that skill first, functionally, like you said, with comfort, that's technically where they're getting their comfort from, which is it's not a negative thing. There's a lot of societal things that go back and forth, and you have to just meet the person where they're at. But if a mom is asking me, if they're like, well, I don't know if I should, or I don't know if, I'm like, if you feel like that's okay with you, then you should do that. It's not biologically atypical. You have to figure out if that's what you want to be able to do. And even along the lines of, so one of the questions that I get a lot, so if we think about like their ability to feel comfortable in their body with feeding, and then, myofascial joint restrictions, those kinds of things, like that's what you and I are thinking about. Well, that's kind of the low-hanging fruit of what we would have to do first. One of the other questions I get a lot is the co-sleeping question.
Oh, yeah.
Right. Is this safe enough? Is this right for us? Is this right for baby? How does that all work out for people? So, I mean, I have what do you feel like you explain when it comes to co-sleeping? If someone were to come to you with a 2-month-old, 3-month-old, and they were like, we've noticed improvement, but also now we want to know, like, should we be sleep training them? What is your opinion?
What a hugely diverse topic, right?
Yeah, but I mean, that's what people want to know. They don't care. They don't care about the neurological or the joint side from us, like the muscle side. They want to know, like, should I do this or should I not do it?
I'm going to be very frank. It's not the biggest, it's not a big question that I get from my patients, maybe because it's not something that they think about, I think, when they're here in my office. I think I've lost you for a second there. Oh, there you are. So I don't get that question so much, the co-sleeping question. Sometimes I'll ask, are you co-sleeping now? Are you doing sleep training? And I only ask those questions when I'm starting to see some changes neurologically as the baby is developing. So I ask those questions probably more than the fact that the patients are asking me about that. The questions that I get asked about sleep with my parents is bedtime routine and how to deregulate them before they go back to bed. So the comfort part of it. And I kind of go, okay, if you're ready, I don't really say, oh, this is the right time to do it. Because again, I think it's just such an individual, like, family situation, right? When it comes to sleeping. So, and some moms are all about co-sleeping till forever. And some moms are like, okay, I'm ready, like 2 months in, and like, I don't even want to, I need my own space. So we kind of support them in whatever way that they want. But again, the question that I get about sleeping with my parents, with my mom especially, is, how do I find the way to get their body kind of regulated in a way that they're down regulating through bedtime routines? And that's the questions that I get probably the most. So
even in that birth to first year, do you feel that even in that birth to first
routine, year? That's the questions that I get the most.
Gotcha. And I think so, even with that routine, like you said, I'm trying to let the audio.
I'm kind of curious what you get, because you get to see them at home.
I think too, the thing is that the reason I get the co-sleeping question is they're like, well, what did you do? So like, did you co-sleep? And then also the other question is because on my list of like one pager that the family gets at the first eval is that's a domain. So if it's mom, it's pelvic health, muscular, orthopedic, and then restorative rest, and then macro, not macro like you're eating, but macro like big picture things like community support, return to work.
Oh, I see.
So it will come up because I'm just like, hey, how is in general?
Yeah.
Where are we at with sleep? I'm like, what are you
Yeah.
thinking? Like, he doesn't sleep enough. He sleeps too much. What is the question here? And then that kind of gives me a chance to do a little bit, to do a screen and like what is typical, and then say, okay, if you really are, and usually they'll be like, I'm really struggling in this area. Can you help? And I'm like, I can't necessarily directly help with that because I'm not certified, but I do know other people who are.
Yeah.
So I'm like, if you get to the point where this is something that you really need to be looking at intensely and you want to change something, then this person can help you. I mean, I had two very different journeys with my two kids as far as whether they co-slept or not. The first, I was like, not at all. I was like, no way, it's unsafe, not at all. He had a pacifier that, in retrospect, I should not have given him, not because it was a pacifier itself, but because it wasn't the right one that I wanted to have. And then with my second, I was too tired. We were in a house and not an apartment, and I cared about very different things. And so he went from, even I think before he was one, he went from a crib to a twin bed because I could be in the twin. He had like the guardrail, the mesh guardrail things on there, so that I could actually go in with him when he needed me to go in, and I would just fall asleep. I wouldn't even like try to I would just fall asleep in the bed. I mean, I still even do that to this point, honestly, and they're 4 and 6, almost 7. So I just, at this point, have been like, this is where we are, because I would rather, and that's another like that family dynamic you said it's different. I would rather go in than have them come into our bed, at least in our house. Like I would rather, because then eventually then it still is our bed and it's their bed.
Yeah.
And so that's just my own, family dynamic neuroses where I'm just like, but when it comes to that tie of the milestones and feeling comfortable in your body as a child, so much of that is going to fall on us as parents and providers, because that's externally what's going to support them. So I think that's also something I don't think is negative.
Yeah. And that's why I kind of keep things really open on my end when it comes to, I don't have this set timeline of when to co-sleep, when not to co-sleep. It really also depends on how well that kid is learning how to self-regulate themselves from a neurological standpoint, practicing neurology-based chiropractic. So to me, if I can teach them how to teach their body how to tap into learning how to down-regulate themselves when it's bedtime, I think that's the biggest key, and then supporting it with nutrition. And I think my answer from our pregnancy talk with sleep is similar to in that way as well.
Yeah.
Because again, ergonomics are great. I think that those are all important things, but every house is so different when it comes to ergonomics as well and their sleeping situation. So, as a chiropractor, I want to make sure that their brain and their nervous system is learning how to do so. And some kids are more routine based, like their actual bedtime routine. Some kids are more prone to understanding what needs to happen in their surrounding before they can get into that. To me, the big thing is the circadian rhythm as well. So when the sun is coming up and the sun is going down, and then nutritionally, right? So like, it's very obvious if we give them, a scoop of ice cream at 8 p.m. after dinner, there's a very good chance they're going to be so highly kind of stimulated that they're going to be unable to calm down. So I think that in that way, that can also be applied for applied to a newborn as well. So even if they're like, again, goes back to the feeding part of it, which is the nutritional part of it, right? So if the mom is eating, she loves spicy food all the time, and and the baby's having gas it's going to affect the way the baby is going to be able to down regulate and go to sleep properly, right? I had another mom just today, and I asked the question. She is now 2 months old, I think, almost. And when I was asking about bedtime or sleep, they're co-sleeping, and Mom goes to sleep anywhere between, she doesn't have a time that she goes to bed. Like me, I'm at 9 o'clock. I start getting my bedtime routine. I'm ready to go to bed at the latest 10 p.m. She doesn't have that. So, and she works nighttime at time when she used to work. Right now, she's on leave right now. But I could see that her nighttime schedule is also affecting this infant as well. So we talked about that a little bit, and I said, I think keeping things routine and consistent, it's okay if it's all right. I mean, it would be ideal if they go to bed when the sun is starting to go down, right? But I get it. There's we're in Las Vegas, so moms sometimes are working really late or sometimes middle of the night, right? So I think consistency, is going to be really key as well. So
yeah, and I think even like you said, the consistency with what is realistic for an infant versus a toddler who's one, right? It's like, we did kind of we changed their bedtimes throughout that range of time, and then at this point now they have pretty much the same bedtime as they have had for a while, and then potentially when we hit that next range, like a preteen situation, that may that will change a little bit again. But I think too, like you had mentioned, that the interplay of things, I think if there's anything that I would want someone to take away from our conversation, is that the interplay between the demands of an infant up to a year old, so like that first year of life, are going to create a sleep environment versus feeling like it's only one thing. It's really not.
Oh, yeah.
If their feeding is off, if they have issues with their myofascial or their torticollis, and they're just uncomfortable in general, then that's going to affect other things, and that's going to trickle down into the sleep and the regulation, switching that on and off. We didn't get to, which is always a fun topic, because if we're going to be on YouTube, let's just be at least a little controversial. The other piece that comes up, which maybe we would address in a later time, is that concept of self-regulating versus self-soothing.
Interesting.
Because there's so much. It's very interesting. Like I think I know what you're, as a PT and a provider adjacent, a colleague, I think I know what you're saying. But for the lay person, it could be really confusing because there's a lot of backlash against like babies can't self-soothe, but how is that different than self-regulate? Because that sounds different to me. Or that sounds the same to me. So that conversation would be very interesting. Because I think that goes into a little more research and like what we're actually talking about is the difference.
And also how early of an age, right? Are we also
ding, ding, ding. When is it appropriate for the expectations? Which mostly I think is where probably would people be like, oh, I see what you're saying. Separate those things. That is all I have today for the sleep concept. But is there anything else you'd want someone to take away or to share?
I would say I have a little tip. I would say it's been my go-to tip for the last few years, I would say, in practice, and it's been helping quite a bit. And feeding the brain properly before bedtime, right? And my go-to tip, obviously, as a chiropractor, I would love to see them on the day that they're not doing well and they're having tantrums and they're just like not regulating themselves, even if they're infants. And I adjust usually, not always, but usually it's an upper cervical, and that can really help with that. I've had moms be like, oh my God, that was tranquilizing. I love that. Can you do it again? And they were calm and they were so good. They were well behaved. Fantastic. But obviously they can't come in just for that every single visit or every night for sleep.
Right.
So my other go-to tip has been giving them a little bit of fat before bedtime. And I think I mentioned that last episode as well. And I do it with my adults too. And I obviously, it depends on like how much you're going to be ingesting and what kind of diet you're really is. But in general, for children, it really works well. Giving them just a high quality fat. The best one that I've noticed that works the best is usually grass-fed butter. right? Whole butter. And usually if they're not used to the butter, then I just start with like a quarter tablespoon of it. And then eventually get them to a point where they can actually have a full tablespoon as well. But again, it depends. Like I've had a couple of kids last week. These are older kids, and they came in last week, both of them, brother and sister, and they were like, "We love the butter at night." And the mom was so happy because they actually stayed asleep fairly well, and they didn't wake up, and they didn't come to their bedroom and wake up mom and dad. So and they've actually started doing that as their part of their bedtime routine. So
and that's easy tip to share. And I think the next we will kind of change topics when we go to the next one, but thank you so much for watching our video and kind of hanging with us as we transition things, and then we'll transition back to what we normally do. But yeah, thank you so much for watching. And then if obviously anything Dr. Rhee wants to share on our way out.
No, I think that was a good topic to talk about, sleep. I mean, there's so much more we can talk about, but that was a good snippet of information that I
within that first year. It's like, let's make it easier for digestible, literally for people in that way. So
exactly. All right. Well, thanks for doing it in this format, and thank you for joining us for this episode.
All right.